Hello, this is Dr. Jeff Selano from Advanced Regenerative Medicine and Colorado Knee and Spine Clinic. Today we're going to take a look at Annabelle's lower back. And full disclosure, Annabelle is my daughter who volunteered to be the patient on this demonstration. The reason I chose Annabelle was a couple of reasons. One is that, as you can see, she's very small, and doing a lower back adjustment, which is what we're going to do today, a lot of women who are smaller think that someone that's 200 plus pounds, maybe that's going to be too rough. And with 30 years of experience and tens of thousands of patients, all different sizes from the womb to the tomb, I'm going to show you that the adjustment probably was going to look the same as if I was adjusting somebody who was a lot larger, but we're going to use a lot less force when we do that. And positioning and technique have a lot to do with it. Just to help people understand that when we adjust someone, especially a lady that's smaller, that we can do the exact same adjustment, get the exact same results, but we can use our technique modification just a little bit, so make sure that she's comfortable and feels safe. So the very first thing, Annabelle, if you'll just give yourself a hug. So just let your arms come on down. So we're just going to do some range of motion. That's the very first thing. So I want to check. Just lean forward. Okay, come on up and lean back over my hand. Good. And then just tip over this way. And this way. And then rotate. And then come back the other way. Okay, so I can feel, relax your arms, I can feel some restrictions in her lower back. Annabelle's, has danced for years. She's very physically fit and in great shape. So, it's not like she walked in here with a ton of back pain, but for the sake of the example, I definitely can feel some restrictions in the lower part of the back, and we're going to take a look at those. So if you will lay on your stomach first with your face on the paper, and before we get started, make sure that you hit the subscribe button and the like, and also the bell. Smash that bell so that you can get any future notifications for other videos that we'll be putting forward. We're going to be making a lot more videos, both chiropractic and in the regenerative medicine side, so stay tuned for that. So just your arms hang straight off the table. And before we get started, Annabelle's wearing a skirt. Now she does have stockings on, but just to protect her modesty, we are going to, and this is pretty standard procedure if we have anybody wearing a skirt, just want to make sure we cover up. All right, so Annabelle, if you would lock your right knee, and I want you just to lift your right leg up in the air as high as you can. And she's a dancer. Okay, put your leg down. And then do the other side, lock the knee, lift your leg up. All right, well that leg can come up a bit higher. So, not scientific, but we're just using some demonstrations to give me some indication of which side we may have a little bit more restriction. So we've got a couple lumbar vertebrae that are out, as well as I think that her right hip, where the iliac bone attaches to the sacrum. Little anatomy for you. You've got 24 vertebrae that are all sitting on a triangular shaped bone down here called the sacrum. It's the base of the spine. And where you've got a dimple here and a dimple here, if you can imagine looking at yourself in the mirror after a shower, that dimple is where the iliac and the sacrum come together. We call that the sacroiliac joint. And I think hers is going to be locked on that side. Next thing I'm going to do is I'm just going to check leg lengths here. Relax your ankles, relax your calves. Kezzy, come on over because I want people to see that I'm not making this up. Just literally, as she relaxes here, you can see that in fact on that right side, the heel lengths are a fair bit different, and you can also see that we've got a little bit of different wear in the heels. So in this case, what I think is happening is that her hip is actually out of alignment and it's rolling. That SI joint is going superior a little bit, which is just drawing that leg up and making the leg length different. So we're going to adjust her lower back, and then we're going to come back and we're going to recheck, check the leg lengths, check having her lift her leg up and see what we find. So let's have you first come over on your right side so you're facing me. And again, just keep the gown in place. Have you bring up. There you go. And let me see your right hand. And I'm just going to bring her off her shoulder, so as I do the adjustment, I'm not jamming her shoulder into the table. That can be really tender. go. And just, there you go. Just relax that shoulder. There you go. Good. Now, as you can see, I've got my leg here against the table. She's not going to roll off the table. Sometimes patients tense up and they think they're going to fall off the table. Not going to let her fall. In 30 years, I've not had anybody fall off the table, and I've had patients in the 400-pound range. So, just have you roll over the opposite way. I'll keep you down in place. There you go. And bring up your knee just a little bit. And hold on to your elbow. She's already off her shoulder. Make a good contact on that SI joint. And for this one, I want you to push back against me just a little bit. I want you to relax your hips, but give me just a little resistance with your shoulder. That's it. You got it. Good. Okay. Come on back on your stomach for me. All right. Now, lock your right knee, and then lift that leg up in the air. Oh! Okay, down. That's different. And then the left side, same thing. Okay, come on back down. Again, not a scientific check. It's just visual for me, but it's also telling me a little bit about the ergonomics of her hip. Okay, so Kesney, take a look. Now, I'm not forcing one leg up or one leg down. This is just how they come together. So we made the correction in the hip. Now we don't have a leg length discrepancy. And Annabelle, if you would, come on, sit up for me. Okay. Give yourself a hug. And forward. Oh yeah. And back. Good. Ragdoll. That way. And then the opposite way. And then rotate for me. Okay, and back. And so now we've got that stair-step fluid motion with the hips. So just think about a spiral staircase as she rotates, especially. One vertebra goes, then followed by the next one, then followed by the next one. What we had was two vertebrae that were actually trying to move together. They were just locked, a little bit out of place. We call it a subluxation. So now that we've freed that up, you can see the leg length difference, which is great. And one of the things that the body does is, even though she had a leg length discrepancy, she wasn't going to stand up. So now her hips are even, but when Annabelle, walked around prior with, about a ½ inch difference with the right hip, she wasn't walking around like this, right, with her hips all out of whack, because the rest of her back and shoulders and neck were compensating, trying to pull her back home. So that means that we're going to then have compensatory misalignments, possibly in the shoulder blades in between with the thoracic spine, and then possibly with the cervical spine as well. So we would want to take a look at those. We won't do that in this demonstration, but we would also want to take a look at those regions as well, because when the hips are out like that and the foundation of your spine is out of alignment, then everything else above it is going to start to have compensations and compensatory misalignments as well. So we'll just take a look at all that. So anyway, thanks for checking in. This is our video on the lower back. Thanks to Annabelle for taking the time and coming in and letting us do that demonstration. And make sure again you hit the subscribe button, and we'll see you next time.